2018, the Embassy of the United Arab Emirates and Johns Hopkins announced the new Johns Hopkins Sheikh Khalifa Stroke Institute, established through a significant gift by the UAE.
The Institute is essentially an advanced R&D and clinical center that will transform treatment for stroke victims and develop new therapies to help them recover.
In fact, from Baltimore to Abu Dhabi, the gift has enabled us to develop new tools for stroke diagnosis, to innovate clinical care, and to create novel technologies, shrinking the gap between research and treatment and enhancing life after stroke. And I'm so proud of the extraordinary people and the partnership that have made this possible.
The night I had my stroke, I was terrified. I remember thinking that I have to fight for my life.
The first minutes to hours after somebody has the onset of symptoms are really the most critical in terms of enhancing recovery. At the Sheikh Khalifa Stroke Institute, we are learning not only new ways to prevent and diagnose stroke, but also new ways to treat acute ischemic stroke. For example, my team has developed new, really exciting imaging techniques looking at areas of the brain that are dysfunctional that can be salvaged by pulling out the clot. We're already in the clinical stages of expanding the window to 24 hours or beyond.
I was in the hospital and could barely move. I was thinking I would do anything to just be able to walk.
Is there anything you need while you're here? Our mission was really to transform hospital care into healing care for stroke patients, and we've done just that. Just try to move your arm around and see where he swims to.
Chronic neurological conditions are complex, and so you have to match their complexity with a complex intervention. The SKSI philanthropy allowed us to build, for example, super rooms, where we have full immersive holodeck-like experience.
That really motivates the patient to achieve high levels of activity, motor activity as well as exercise.
And right out of the gates, a small pilot trial with the dolphin, it proved to be twice as effective than just a regular rehab. This is just the tip of the iceberg. We've just begun.
Little things really give you hope, because then once you get through that one step, then you know that you can go further.
At the Sheikh Khalifa Stroke Institute, we want the journey for the patient to be seamless. When a patient leaves the inpatient service, they immediately come to the outpatient path programs, where we have to facilitate movement. For example, muscle stiffness sets in when sugar molecules inside the muscles congeal together. So one of our clinical trials involves using the enzyme hyaluronidase that dissolves this sugar molecule and facilitates movement. The most fulfilling part of my job is to really see my patients come back and do things that they couldn't do before.
Through our partnerships, the impact of the Sheikh Khalifa Stroke Institute goes well beyond Baltimore and the United States to Abu Dhabi and the rest of the world.
First, we've established a community of practice to drive standardized education, protocols and standards, and functional outcome measures, which drives improved outcomes for the patient.
Stroke care is all about a system, trying to build the best system that suits our population, having comprehensive centers based on best medical practice.
In addition, we have learned lots of new advances by using different new technologies, like the non-invasive brain stimulation program and the next generation room.
Our drive is to have the patients into the hands of the stroke rehabilitation teams in the early stages of stroke management.
We're also working on prevention. For example, an AI-driven platform to detect intracerebral hemorrhage in CAT scans. We're looking forward to continuing this work, taking stroke care to the next level.
In the last few years,
We have developed new, really exciting techniques.
Especially in the area of neurorestorative treatment.
We created a stroke unit of the future.
And it saved my life.
What began with a generous gift from the government of Abu Dhabi, the largest gift ever designated for stroke, has meant revolutionizing the care of stroke patients around the world.
With this tremendous foundation, the next several years will bring even greater discoveries, innovations, and treatments for our patients.